Hello, my name is Abigail Deardorff, and my article is about the causes of death among cancer patients. So for just some background, cancer is the second leading cause of death in the world. We have been able to lower a lot of those mortality rates through research, largely in USA and Europe, but other countries have made progress as well. But that's mostly due to advancements in prevention, diagnoses, and treatments. And certain cancers do still have higher mortality rates than others. We have made more strides with certain types of cancers than others, namely like breast cancer, like testicular cancer are pretty treatable now, but things like lung and brain cancer still have about the same like mortality rate. But a lot of mortality studies have just focused on like a single cancer and their respective causes of death. But in this study, we'll be simultaneously comparing various cancers and all different types of causes of death that come along with that. For the methods, this was largely an observational study, so they utilized data from the National Cancer Institute Surveillance Epidemiology and End Results, or SEER, and that would tell like the different causes of death among patients. And then the deaths were categorized either as index, non-index, or non-cancer. Index cancer being like the primary cancer that they're diagnosed with, and non-index cancer is the secondary primary cancer, so whatever it like metastasizes to next. And then the standardized mortality ratios, or SMRs, were calculated and then also adjusted for age, race, and sex, also just to compare the mortality risk with the general US population. So this is the first figure, and it's just showing our general progress over the years with where we've gotten with treatment. And starting in like the 1970s and going to like the 2010s, it's just showing like the mortality rate. And the colors here, light tan is for head, neck, and skin cancers. Yellow is genitourinary. Blue is male specific. Pink is female specific. Dark tan is gastrointestinal, and gray is hematologic. But the general trend that we see here is a decrease in deaths from index cancer. So we see like a negative slope there. But contrary to that, and the green is the non-cancer causes. So typically as there's a decrease in the index cancer death, there is an increase in the non-cancer causes, along with heart disease is a common non-cancer cause. But not a lot of difference in like the non-index cancer, but the non-cancer increase is largely due to the effects of the treatment itself and the effects that it has on the body afterwards. Just to start on a more positive note, the cancers with the greatest improvement of index cancer care. So it's the light tan, the head, neck, and skin cancers, and then also just the general, the female and male cancers. So prostate, especially like testicular cancer, like right around like the like mid 1980s, 1990s, is like severely decreased. But there is a pretty general decrease in all of these. But again, we do see that like they're at least other than like a couple of these, but for most of them, as there's a decrease in the index cancer deaths, there is an increase in the non-cancer deaths. And then some of the cancers that have like consistently high mortality rates and less progress made, namely like liver, gallbladder, pancreas, lung, brain. So also with that, we don't really see an increase of the non-cancer deaths along with that. Like everything else is pretty stagnant. Sorry, my face is blocking the bottom one, but all of the the lines on the bottom are all pretty straight down there. It's mostly just the index cancer itself that's causing the death there. So this is the next figure, and this is showing the standardized mortality ratio for leading causes of non-cancer deaths by age of diagnosis. So on the x-axis, we have the age that they were diagnosed, and then each graph represents a different cause of death, and the lines are the type of cancer that they were diagnosed with. So there is a pretty general decrease in non-cancer deaths. Depending on like whenever you're older, you're less likely to die from a non-cancer death. Again, this is largely because a lot of the non-cancer deaths, it's from the treatment itself, so you're just doing less time with the treatment or less time after that the older you get, so you're less likely to see more of those side effects. But also, like, the lower on the graph is you're at a lower risk, and then higher up on the graph is that you're at a higher risk of non-cancer death. So again, just zooming in on a couple specific graphs here. So we still do see this general trend of the decrease in non-cancer deaths, but the main exception here is Alzheimer's, and this is still something that's being pretty actively studied, but you are more likely to die from Alzheimer's if you are older. And then this is also just showing on the right here is just the different types of death by age, just in one graph by itself. So a lot of it, whenever you're older, is going to be diseases of the heart, but when you're younger, it's actually more infectious and parasitic diseases. And again, it's just the effects of the treatment and the effects that it has on your immune system. So this is the final figure, and this is again looking at the SMRs, or the standard mortality ratio, but this one's going to be characterized by the length after diagnosis. So on our x-axis, it's the amount of time after getting diagnosed, and then the y-axis is again the SMR. So lower on the graph, you're at a lower risk, and higher on the graph, you're at a higher risk from dying from these non-cancer deaths. And again, each graph is labeled by which type of like death it is, and then the lines are the types of cancer. So we do see, especially for lung cancer, which is in like the lung and bronchus cancer, it's like the darker like magenta here. It's pretty high mortality like directly after diagnosis from a lot of these like causes, which is also probably likely largely why it has such a high mortality rate. This is pretty like soon after getting diagnosed that these are happening. But then there is a decrease for most of this, but to look at some of them closer up. So just to zoom in on some of these specifically for the non-cancer death by time after diagnosis, we have first the other infections and parasites. So this is going to be a lot of it peaks pretty early on, and that's going to be at the height of treatment and when people are the most immunocompromised after. But there is more of a decrease later on, like after they've gone into remission or been in it for a while. But the outlier there is for Kaposi sarcoma, and that's just because it directly affects the immune system as well. So it's just it taking a double hit, and it's harder to recover after that. And then for the next graph, it's suicide and self-inflicted injury. So there is a large peak there for lung and bronchus cancer, and that's just going to be because of the high mortality rate for that cancer and people knowing that when going into it. So a lot of people just don't want to spend their last days going through the treatment or just going through it at all knowing the outcome. And that is a general trend also with the other types of cancers, where there is like a slight peak directly after treatment, or like just within a couple years of getting it. That could just be from also like people not getting, like seeing the improvements that they were hoping for. But the other outlier on that graph is for testicular cancer, which kind of follows a complete opposite trend of the others. And that's more due to like a loss of quality in life. A lot of men with testicular cancer will end up developing erectile dysfunction or infertility, so just a general decrease in their quality of life. And then for the diseases of the heart, it does follow a more normal trend of the other graphs, but for Hodgkin's lymphoma, there is more of an increase like a good bit after getting treatment. Again, it's just from the lasting effects of treatment like on the body. So just to wrap things up for the discussion, so for cancer cause mortality, the ones with the lowest mortality rates are going to be prostate, breast, and testicular cancer. But and this is mostly talking about like index cancer, not necessarily from like all of the causes of death. But and then the ones with the highest mortality rates are going to be lung, pancreas, and brain cancer. But also what they have found is, like, while there has been an overall decrease in mortality just because of all of the non-cancer deaths that go along with that, it's not very significantly different because they're still dying, just not from the cancer, which is kind of the importance of like this type of study showing that type of thing and developing treatment to account for that. But so some of the top non-cancer causes of death were cardiovascular disease, infections, suicide, and Alzheimer's. So cardiovascular disease and like Alzheimer's is definitely going to be more later on, like infections and suicide is earlier on. Although suicide is more spread out between age group. But secondary cancer concern, there are certain cancers that are more likely to metastasize than others. So especially with prostate, breast, lung, colorectal, oropharynx, testes, larynx, and Hodgkin's lymphoma survivors, this is very important to analyze and test for after like following treatment to account for that. So just based on all of this, priorities for future research would be just improving treatments for still like the cancers that have the highest like index mortality rates. It's the brain, lung, pancreas cancers, just generally developing for that, but also a decrease in the non-cancer deaths and looking at the effects of treatment and how we can lessen those effects on the body. And then increasing surveillance for the secondary cancers as well, especially for the cancers I mentioned prior. And then improving mental health support in treatment and following treatment so can decrease the amount of deaths from suicide or self-inflicted injury as well.